Okay, we're going to be going over the patient interview history. And first, you would start off with your OPQRSTT. O is for onset. When did this start? Was it a sudden thing or did it gradually come on? P is for provocation. What brought it on? What makes it better or worse? Q is for the quality. Ask that patient to describe that pain. Are there any changes since it began? Does it feel differently? R is for the region or radiation. Tell that patient to point to where that pain is. See if it's radiating through certain parts of their body. Get them to better describe it to you. S is for the severity. On a scale of 1 to 10, 10 being the worst pain you ever felt in your life, how is your pain? T is the time. Is that pain constant or does it change over time? The second T, are you taking any treatments pertinent to that situation at hand? All right. Second, in the past medical history, is using sample her. S is for signs and symptoms. Look for those. A, ask the patient if they are allergic to medications, food, or something else in general. M, are you taking any medications for that problem? P, are there any past pertinent history related to your issue? If you have any past surgeries, or maybe there's some episodes or situations you've had in the past involving that. L is the when and what. E, is there events leading up to that situation? What were you doing prior to? Maybe something that you just did caused what's going on. H, do you have any habits that contribute to your situation? Maybe you do something all the time that is a good clue to what's going on. E, how is that environment? And R, are there any other risk factors involved? Third, you get into the big part. You get into your secondary assessment. You would check the brain, lungs, and heart from the start. You would focus on that affected body part or system after the fact. Checked for symmetry. Check for pleura, discharge from the ears, nose, or throat. Check the neck for JVD, possible need for C-spine. Maybe if the tracheal midline is midline or if it's off to the side. Check for pulmonary issues. Listen to your lung sounds in the front and back. See all those lung sounds. See if they're clear, if they've got something going on in there. Check the heart using PMS on both sides. Check cap refill and see if the patient has any pedal edema, which may give you just some clues to what's going on. Check the skin color, obviously, and check the abdominal region to see if they have any pain going on. Also, remember to go over your cranial nerves and test the patient's psyche through their mood, appearance, speech, and maybe what they're thinking at the time. Fourth, you need to determine the vital signs. Go for temperature, your pulse, rate, rhythm, and quality, your respirations, rate, rhythm, and quality, your blood pressure, your oxygen saturation, take a glucose stick maybe, CO2, ECG, skin, maybe they had a loss of consciousness, and check their eyes again. Fifth, you would state your field impression of the patient and give a differential diagnosis to what's going on. Sixth, you would verbalize a treatment plan for that patient and use appropriate interventions in a timely manner for the betterment of that patient. Don't do something wrong in that situation. And finally, you would reevaluate your transport decision and hit the road.